Hello friends, welcome back to Aluda Health Trip with new video. In today's video we are going to discuss about bone marrow transplant. What is bone marrow? Bone marrow is a soft and spongy tissue found in the cavities of certain bones in the human body. It plays a vital role in the production of blood cells and is a crucial component of the human circulatory system. Bone marrow contains stem cells, which are unspecialized cells capable of developing into various types of blood cells. There are two main types of bone marrow. Red bone marrow. This type of bone marrow is responsible for the production of red blood cells erythrocytes, white blood cells leukocytes, and platelets thrombocytes. Red blood cells carry oxygen throughout the body. White blood cells are essential for the immune system and fighting infections, and platelets help with blood clotting. Yellow bone marrow. Yellow bone marrow contains a higher proportion of fat cells and is less involved in active blood cell production. However, in times of severe blood loss or certain medical conditions, yellow bone marrow can convert back into red bone marrow to assist in increased blood cell production. The process by which bone marrow produces blood cells is called hematopoiesis. It involves the constant division and differentiation of stem cells into the various types of blood cells needed to maintain a healthy blood supply. Bone marrow is found in larger quantities in the cavities of certain bones, including the hip bones pelvis, breastbone sternum, ribs, vertebrae spine, and the ends of long bones like the femur thigh bone and humerus upper arm bone. It is essential for the body's ability to maintain proper blood cell counts and respond to changes in demand, such as during illness or injury. Medical procedures involving bone marrow, such as bone marrow biopsy or bone marrow transplantation, are performed to diagnose and treat various blood disorders, cancers, and other medical conditions related to the bone marrow. A bone marrow transplant, also known as a hematopoietic stem cell transplant (HSCT), is a medical procedure used to replace damaged or diseased bone marrow with healthy stem cells. This procedure is often performed to treat various medical conditions, including blood disorders, cancers, and certain immune system disorders. Here's an overview of how a bone marrow transplant works. Bone marrow transplants are used to treat conditions where the bone marrow is not functioning correctly, either due to disease or because it has been damaged by chemotherapy or radiation therapy for cancer treatment. Some common conditions treated with bone marrow transplants include leukemia, lymphoma, aplastic anemia, and certain genetic disorders. Types of transplants. Autologous transplant. In this type of transplant, a person's own stem cells are collected and stored before high-dose chemotherapy or radiation therapy. After the treatment, the stored stem cells are infused back into the person's bloodstream to help their bone marrow recover. Allogenic transplant. This involves using stem cells from a donor, typically a close family member or unrelated matched donor. The donor's stem cells are collected and transplanted into the recipient to replace the damaged or diseased marrow. Stem cell collection. Stem cells for transplantation can be obtained from various sources, including the bone marrow itself, peripheral blood collected from the bloodstream through a process called apheresis, or umbilical cord blood collected from the umbilical cord and placenta of a newborn baby. Preparation. Before the transplant, the recipient often undergoes a conditioning regimen, which may involve high-dose chemotherapy and radiation therapy. This helps to destroy the abnormal cells in the bone marrow and create space for the new stem cells. Transplantation. The healthy stem cells are then infused into the recipient's bloodstream, similar to a blood transfusion. The stem cells travel to the bone marrow, where they begin to produce new blood cells. Engraftment. The process of the transplanted stem cells settling into the recipient's bone marrow and starting to produce healthy blood cells is called engraftment. This process can take several weeks, during which time the patient is closely monitored. Recovery and follow-up. After the transplant, patients require careful monitoring and supportive care to manage potential complications, such as infections, graft versus host disease in allogenic transplants, and other side effects. Bone marrow transplantation is a complex medical procedure associated with risks and potential complications. It requires careful evaluation of the recipient, selection of a suitable donor in allogenic transplants, and close medical supervision during the transplant process and recovery period. Advances in transplantation techniques and donor matching have improved the success rates of bone marrow transplants, making them a viable treatment option for many individuals with certain medical conditions.